Hi, I'm Dr. Singhania from Singhania Clinic, and I'm going to talk about treatment of depression in children. Despite high rates of depression, less than half get treated. Depression can be seen in anywhere from about 15% of children to 57% of children with learning problems. And horrifically, a study showed that only 7% of adolescents who committed suicide had received any prior help. So the first step towards treating depression is to recognize its presence. Understand that depression in children presents in different ways depending on the age of the child and the circumstances. And when we do a diagnosis, it requires an open mind, understanding of child development, and we need to analyze and identify different factors. Look at the family history, identify stresses, look at the academic performance and the school, if there is any bullying or treatment of depression has been identified as behavior therapy. In this, the child is given more positive reinforcement. So there are more positive interactions and the punishment from the environment is reduced. The child is given social skills training, so how to make friends, how to express their feelings, how to deal with bullying, assertiveness training. They are also showed self-monitoring, so they know that I have to do so much exercise or go out to play because this is going to help me feel better. Similarly, relaxation training is part of behavior therapy, where the children are taught to relax and even the older kids taught mindfulness. Cognitive therapy is changing the distorted thinking these children may have developed. So they tend to magnify a problem, or they only see the negatives and ignore the positives. They have things like, what's the point? They also have what we tell the children, unhelpful thoughts. So for example, if there are two girls, Sarah and Aisha, and they both invited their friends over to meet them after school, and both the girls say, no, we can't do because we have homework. Now Sarah may have negative thinking or irrational thinking, and she'll start feeling rejected, and she'll say, my friend doesn't like me, I have no friends, and start feeling upset. Whilst Aisha may say, oh, okay, so she is busy today, but maybe next week we can meet. So these kind of distorted thinking has to be taught to the children, how this impacts the way they think and feel. Cognitive behavior therapy is taking elements of both, and in fact is the most common approach to treating depression in children. And of course, the relationship between mood, thinking and behavior is explained, and they have to recognize it, etc. Interpersonal psychotherapy is used for older children, especially teens. It explores family and interpersonal relationship, and how they can propagate and increase depression. So they have to again recognize their distorted thinking and try and rectify or change it. Family therapy and parent effectiveness is very important part of treatment of depression in children. Negative parent-child interactions are replaced by more positive interactions, more fun-filled activities, more effective and less harsh forms of discipline are used. The communication styles are increased, and parents and families given support. Medication is also used in some percentage of children. SSRIs like fluoxetine is well researched in children. It may not necessarily be used as the first line or as the only treatment. It should never be used as the only treatment, and it's used for more severe forms of depression. If you're seeking help, please visit our website www.singhaniaclinic.com or call us on the number shown below. Thank you for watching.